Good afternoon, and welcome back to our Health Leaders The Winning Edge program, a weekly series of live webinars touching on the topics and strategies that you need to know most. My name is Marie DeFreitas, and I'm the CFO editor for Health Leaders, and I'm going to be your moderator for this session. Today's webinar is titled The Winning Edge for Lowering Labor Costs. Thank you to our audience for participating. Before we get started, for those of you in our live program, I have just a few housekeeping details to go over real quick. So firstly, our program is approximately 60 minutes in length, and note that an on-demand version will be available on our YouTube channel on Friday, and this can be accessed through our website, healthleadersmedia.com. To ensure that you guys can see all of the content from the event, please maximize your event window and just be sure to adjust your computer volume settings or PC speakers for optimal sound quality. Next, you're going to find a resource list for today's webinar on the upper right-hand corner of your screen. Here we have listed the webinar slide deck for you to download along with some other resources. Also here you can find a registration link for future The Winning Edge events. At the bottom of your console, there are multiple widgets that you can use. To submit a question, you're going to click on the little Q&A widget. It may be already open and appear on the left side of your screen. To submit a question at any time during the presentation, you can do that. However, please note that it's likely your questions probably won't be answered until the Q&A portion of our program. Finally, should you experience any technical difficulties during today's program and you need some help, click on that little help widget, which has a question mark icon, and this will cover all your technical issues. So at this time, it's my pleasure to introduce our two panelists we have today. First, we have Kaitlyn Anderson, and she is the Director of Finance at AdventHealth. And we have Brandon Williams, who is the Chief Financial Officer at Providence. So thank you both for joining us. And with that, let's get into our discussion. So firstly, I'm going to have you guys tell us a little bit about yourselves and your organizations. Brandon, do you want to start us off? Uh-oh, Brandon, I don't think we can hear you.
Sorry about that. So I'm Brandon Williams, the CFO at Queen of the Valley Medical Center, part of Providence Health System. We're a 200-bed hospital here in Napa, California.
Awesome, thank you. And Kaitlyn, how about you?
Hi, yes, I'm Kaitlyn Anderson. I'm Director of Finance at AdventHealth in our Central Florida division. Just a little bit about AdventHealth. So we operate in 9 different states, a little over 50 hospitals around the country, but really mainly located in the Orlando, Florida area. So I'm here in Orlando and again, working from our Central Florida division, which is about 8 hospitals. So I'm excited to be here. Thank you guys.
Awesome. All right. Thank you both. So firstly, before we get into our first question, I want to start with just a couple numbers to give a little context of where this challenge of labor costs kind of led the industry over the last few years. So according to the American Hospital Association, there's going to be a projected shortage of about 100,000 healthcare workers by 2028. And a lot of these are going to be nurses and nurse assistants mainly. But this will obviously have huge implications for care, but also for the physical health of health systems, from big hospitals to small rural providers. So our first question is, how are labor shortages impacting your health system's financial performance, and what strategies have you implemented to mitigate these costs? And Kaitlyn, let's start with you on this one.
That's good. So I think during the pandemic, especially, we all struggled with a shortage of nursing leaders and nurses. And so for us specifically, we were, of course, forced to pay a premium on agency contracted workers. And that was a huge impact to us, as I imagine it was an impact to others as well. So over the last few years, we've been on a big journey to reduce our high labor costs. And I would say we have accomplished this really out of 4 main strategies. So first being that we focused a lot on reducing our agency workers and converting them to full-time. So I'll talk a little bit more about how we did that and what we did, but that was our biggest strategy, was reducing our premium labor and agency workers. Secondly, I'd say we've focused a lot on reducing length of stay. That has helped save us a lot of money around what we're paying out in labor. So So not only does length of stay reduction, help with reducing the cost of labor, but also it's helped us create a ton of capacity. And so that would be probably my second strategy. And then thirdly, we have a ton of recruitment and retention strategies to try and make sure we're not losing nurses and that we're keeping them here at AdventHealth and keeping them aligned to our culture and our mission and vision. And so that's been a huge part. And then lastly, about maybe a year or so ago, we created a workforce management department. And so that team has really done a lot of work in finding efficiencies and helped us find consistency even across our hospitals. So I'd say those are the main strategies we've implemented and that we've seen the biggest impacts from.
Great. And Brandon, how about you?
Well, pretty similar to Kaitlyn, we did notice that COVID played a pretty large part in the labor shortages for our health system. Everybody seems to have a much tighter budget. We've chosen to attack that on a few fronts. Mainly for us, we've done a lot of focus on recruiting, also training a lot of our employees up. Also looking at new grads as well. So really trying to focus on getting them in and then actually trying to retain them as well. And then we're also seeing that same labor shortage as well on our medical group. So really having to think outside of the box, come up with different creative strategies to really recruit docs to stay within our medical group as well. And then also leveraging technology. I think technology has really helped us close that shortage gap as well. Mainly looking at doing a lot of repetitive tasks, focusing on certain areas that we could control, such as patient access. So.
Okay, got you. Awesome, thank you. Alrighty, so our next question, which actually rolls great into that, talking about technology. So in the context of a tight labor market, what role does technology and automation play in lowering these labor expenses without sacrificing that quality of care? Brandon, do you want to continue on this one?
Utilize technology and automation is mainly it's mainly around administrative tasks. So things that are pretty repetitive, such as checking for authorizations, some insurance verifications. We're utilizing technology a lot in that space, which has helped us on a few different fronts and really help us put our employees back to direct patient care. So mainly focusing around our nurses and making sure that they're able to provide our patients with the quality that they need. Another thing that we've started to look at a little bit more is telenursing. So when you have different forms where you're able to have nurses be able to monitor patients across an entire unit, I think that really helps so that our nurses who are actually on the floor can continue to give the patients the care that they need.
Oh, okay, awesome, cool. And Kaitlyn, how about you?
Yeah, similar to what Brandon was saying. And we're also starting to tap a bit into AI as well. So I feel like when people talk about technology, first thing I think of is AI. It's kind of the buzzword right now. And so for us at AdventHealth, AI, it sounds exciting, but we don't want to replace our team members with technology. We really just want to utilize technology and AI and Copilot to help our workforce be, more efficient, more effective in doing their jobs. So essentially, we like AI because it can help with streamlining basic tasks, but we're still, learning. We still know that there's in the future it'll become more reliable and advanced, and will become more useful and powerful in the future. So that's kind of the new thing that we're diving into is how can we use AI to help our team be more efficient and be more streamlined.
Yeah, for sure. No, there's definitely a lot of hype around AI and new technology in general, for sure. So yeah, definitely taking that focused approach is definitely a big part of the equation, for sure. So our next question is, how do you guys balance the need for cost reductions in labor with the requirement to maintain that high quality patient care on top of keeping employees satisfied? Kaitlyn, do you want to start us on this one?
Yeah, sure. So I think that as we're thinking about labor reductions. We don't want to focus so much on how can we cut costs? How can we comb through everyone's budgets and find pennies here and there? I think our focus needs to be more on, what do we need to do? What strategies do we need to put in place to make sure that we're remaining financially viable so that we can then be in a place where we can invest our resources back into our team members, back into our patients and community. And so essentially, every decision that we make is done hand in hand with finance and our clinical leaders. And so I think that building that bridge between finance and the clinical side is really important. And just making sure that, I'm staying close to my nursing leaders, to our physicians, and our clinical leaders to make sure that we're working side by side, we're on this journey together, and we're not making any decisions that are sacrificing the quality of patient care. Because ultimately, our mission is to deliver clinical excellence, and we want to make sure that people feel safe when they come to our hospital and that we are providing high quality care. And we want to make sure our team members are happy and that we're fostering a culture that has growth and development opportunities for them. And so I think it's all tied in with our vision, and we have to make sure we're not making simple finance decisions that can impact patient care and can impact our employees, who are ultimately the ones who are taking care of our patients.
Yeah, for sure. No, definitely. I've definitely heard from a lot of CFOs how important that organizational culture of trust is just within the health system. Super important.
Absolutely.
Yeah. Brandon,
Absolutely.
What do you have to say about this one?
For me, I think having that close relationship with our executive team, working with my CNOs, CMOs, so that we can really look at how finance plays a part within our labor is pretty critical for us. One of the other things is mainly looking at having lean operations, looking at leveraging technology, having appropriate staffing models. I think that helps us from both a financial perspective and an employee satisfaction perspective. And also really listening to our employees, trying to understand what is it that they need, how can they be more efficient. So I think combining all of those things together really helps us to balance that need.
Yeah, for sure. Yeah, it's definitely a lot to balance. Alrighty. Our next question is about staffing models. So what do you guys think are the most effective staffing models that you've seen or maybe adopted in response to these rising labor costs, such as like flexible or part-time staffing arrangements? What do you guys think about these? Brandon, do you want to start on this one?
Strategies to help us become more operationally efficient. We really seen a rise in more per diem rules. That's helped us to really maintain a lot of our coverage without over or understaffing, really based on our need and our volume. I think that gives us a pretty great option, considering that you're able to really set those particular schedules and really fill in the gaps.
Yeah, for sure. Yeah, I think it's definitely an important part of it. Kaitlyn, how about you?
So some of the staffing models that we've put in place, and I think maybe this leads more into your next question about contract labor, but something that we've done specifically is, as we've focused on reducing our contract labor and agency workers, we set up our own internal agency, which we called StaffLex. And so basically the way the StaffLex worked is anyone who is working at AdventHealth as coming from an external agency as a contract worker, we asked them, hey, would you be interested in working for our internal agency? And you can be aligned to AdventHealth, and basically you'd be kind of working for us, but you're still a travel nurse. You can still work at our hospitals around the country, and it's just that we'll kind of own you. And so we, sorry, that was a bad use of words.
You're fine.
Basically we like you, so we want you. Kind of. So basically we put a lot of focus on converting those those agency workers to staff flex workers, and then focused on converting those staff flex workers to full-time employees. And so just to give you a couple stats, over the past couple years, we were able to convert over 500 people from agents, like outside agency people, into our staff flex internal agency. And then 40% of those staff flex people decided that they wanted to take on a permanent full-time role at AdventHealth. So that was a huge, huge win for us because, you know, of course, we're not having to pay a premium on these people anymore. And it was a huge way that we were able to get people aligned with our mission and vision. And they said, hey, I really like working for you guys. I like my team members that I'm working with. Like, I like what you guys stand for. And so, yeah, I want to come and be a full-time employee. And we're able to keep them at AdventHealth and, you know, not be paying that premium on them. So that, yeah, that's something I was really excited to talk about is just being able to convert people to full-time staff just through those recruiting and retention efforts. And so, yeah.
Yeah. No, that's awesome. That's really impressive. Yeah, no, it definitely helps. It seems like, yeah, to just have like these options available is definitely a big part of it. That's really cool.
Definitely.
Alrighty. So yeah, that is a bit of our next question. So our next question is many health systems, and certainly like a lot of CFOs I've spoken to, have found some financial wiggle room, so to speak, by cutting back on contract labor. And I think this is kind of a trend we're seeing more in the industry a little bit more and more. What are your thoughts on this approach in today's economy? Brandon, do you want to kick us off on this one?
There is a lot of financial wiggle room. Sometimes when you're looking at contract labor, that can be almost twice as much money as what it is to have somebody who's full-time on your staff. And although we've cut back significantly on our contract labor, I do find that there is still some need for having it, particularly around some of your hard-to-fill positions. One of the things that we've also done to pretty much combat that is similar to what Kaitlyn said. So we have some people that float within our organization. They're still a part of our family, and we use them to really fill in some of those gaps where we have at different hospitals. And we've seen this a lot with some of our managers as well. So as we're training certain people up, or maybe you need a little bit of lead time until we're able to onboard somebody, we've been able to use some internal people as well to help fill us in.
Got you. Okay, interesting. Yeah. And Kaitlyn, did you have anything else to add on this one? I know you spoke about it a bit, but if you had anything else to add.
Yeah, just to add to kind of what Brandon said, I agree. I think there's still a use for some contract labor. Mm-hmm. For us specifically, we have a lot of agency workers who work in our laundry area, and so that's an area where it actually makes sense for us to contract people out to work in our laundry because it's cheaper for us to do that versus paying full-time employees. So, and that's kind of a separate discussion, but that's the reason why we decided it's actually good in some areas for us to keep contracted workers where it makes sense. So while we're not totally eliminating contract workers, we're focused on how can we eliminate it in more clinical areas. And so by now we've completely eliminated contract workers in nursing. So all of our nurses are full-time staff at this point, and which is a huge win, just coming out of the pandemic. So
yeah, that's awesome. No, that definitely, it definitely feels like it's never one size fits all type of solution. You're definitely figuring out what works best for your specific goals and challenges within your system, for sure. That's cool. So into our next question, burnout is certainly a big topic within the industry. We've definitely saw it a lot during the pandemic and after it, for sure. But now many health systems are still figuring out how to deal with it as it's progressing, and what tools and methods are kind of the best options for dealing with it. So our next question is, how do you guys evaluate the ROI of investments in workforce optimization? Things like workforce management tools or training programs. How are you evaluating this ROI on these products? Kaitlyn, do you want to start on this one?
Sure. And just a clarifying question. So when you say ROI on like tools or training programs, are you looking for like what metrics are we looking at tracking, or like what types of that, or do you mean like financial ROI? Just want to make sure I'm answering it correctly.
Yeah, if you have any metrics, or whatever you can speak to about this within your organization, for sure.
Okay. So I'll give an example. I think earlier I mentioned that about a year ago or so, we created a workforce management department. So I think a lot of different organizations have a workforce management team. We surprisingly didn't have one. We kind of just managed labor at the hospital level, and it was working for us. But I think we realized, as we were looking at benchmarking data from Premier, I don't know if anyone else uses Premier benchmarking, their benchmarking tool, but we've been doing a lot of work with looking at the data that Premier gives us, and we're able to benchmark against other hospitals in the industry and that are similar to us. And our workforce management team, through that benchmarking work, has been able to find a lot of opportunity for efficiencies and even consistency just across our own 8 hospitals in the Orlando area. So there's a lot of opportunity that we've identified. We haven't quite done anything with that information yet because it's very new to us from just the past few months. But at this point, we're building Power BI dashboards to start tracking this information. And as far as ROI, I think the investments that you make in a team can have a big result, can have a big ROI. So, for example, and I'm just throwing out numbers here, but let's say we invest $1 million in creating a department of people who come to work every day thinking about how can we make labor more efficient, or what opportunities can we find. And then that team is able to identify, $40 million of potential savings. And so that in and of itself is a huge ROI just on that team of people who come to work every day thinking about this, and they're able to find savings. So it kind of pays for itself, So that's something that we're thinking about is, what intentional investments can we be making that can give us big results? Another example is length of stay. So I talked about how we've been on a journey to reduce length of stay, which has resulted in a huge amount of savings in labor. So we created a team of people who come to work every day thinking about how can we reduce length of stay, and how can we get everyone on the same boat and on the same journey to make this happen. And we've been able to, cut half a day out in our length of stay, which is huge. So those are, just some things that we're thinking about. And let's see, as far as metrics, we're looking at labor productivity %. We're looking at premium labor as a % of total salaries and wages. We're looking at length of stay, and and looking at our turnover rate. So I would say those, I rambled a little bit, but those are kind of the big things that we're looking at right now.
Yeah, for sure. No, there's definitely just a lot that goes into it in general, and like definitely a lot of different factors you can look at. 100%. No, that's impressive for sure. Brandon, how about you? Oh, sorry, Brandon. Oh, sorry, Brandon. Could you just start over real quick? Your audio cut out for 1 second.
Our Power BI tools. For us, those workforce management tools have been pretty critical, and we've seen a lot of those benefits, ensuring that we are optimized across many of our departments. I think it really helps us to maintain a high productivity and brings in a focus a lot of our staffing needs. Mainly the way that we use the Power BI tool is, one, we benchmark ourselves against other hospitals within our organization. So Providence has just over 50. And then as well as looking at some other organizations outside of Providence as well. And mainly we're looking at our productivity. We're benchmarking ourselves on overtime, agency percentage, even missed meals breaks, even our missed meals and break penalties. So we try to make sure that we're utilizing all of those things so where we can see that return of investment, both financially and within our staffing.
Oh, okay, awesome. Yeah, that's really cool. So our next question, I want to talk about hiring practices a little bit. And so obviously, a big part of the labor equation is obviously hiring practices with wages and benefits in there as well. And many health systems, at least that I've spoken to, are kind of struggling with recruiting a bit. So I wanted to ask, what role do wage compression, wage compression and benefits packages play in your approach to controlling labor costs? And how are these factors affecting recruitment and retention? Brandon, do you want to start on this one? I'm trying to go back and forth with you guys a bit. Oh, sorry, Brandon, your audio keeps cutting out again. Okay, there we go.
Yeah. So wage compression, I think, is something that most health systems are seeing with demand for specific skills and roles outpacing supply, minimum wage increasing, and really a lot of rapid inflation. So it is a balancing act to resolve some of those pay inequities. We try to look at merit and market increases while maintaining a fiscally responsible budget. Incentive pay based on performance in lieu of increasing, for example, base salary is one way that we try to combat that wage compression. And then also having a feel for what's important to our employees, such as an excellent benefit package or developmental opportunities or flexible schedules. Maybe looking at working from home if that's something that's very important to an employee. So I think all of those things are really key to the recruitment and retention process. And it really helps to combat a lot of that wage compression as well.
For sure. No, yeah, that's a good point. Kaitlyn, how about you?
I completely agree. So we're doing the exact same thing here at AdventHealth. So we've made lots of investments over the last few years in recruitment and retaining our team members. So just a few examples similar to what Brandon listed off. Making sure that we periodically do market adjustments. And so making sure our team members are being paid a living wage, making sure they feel fairly compensated. And then as far as benefit package, we offer tuition assistance. That's been a really big part of our recruitment and retention strategies. And then we also have a student loan repayment program as well. Especially for our nursing team. And then some new things that we did this year. So this year we rolled out a new health insurance option for our employees. So we're now offering a third health insurance option that's more affordable. Another thing we did this year is that we are now increasing how much PTO team members are able to earn at the start of their employment. So just getting people, as they're onboarding at AdventHealth, they're not having to wait months to be able to accrue enough PTO to take time off. We want to make sure that they start with, however many days of PTO right up front. And then another thing we rolled out that's new this year is a new retirement savings program that now doubles the amount that we match in our contribution. So that was some investment we made. And then I think Brandon talked a little bit about academic partnerships. I think you talked about that earlier. So we are making partnerships with some universities in our area. So we have, UCF, Valencia, Seminole State, and making sure that we stay close with their nursing programs and that we're investing in those students there and making sure that they have a career path into our hospitals. And so, they do their clinical rotations at our hospitals, and we want to make sure that they are set up to be recruited and to come work on our team. As far as our team members, we have been putting a lot of emphasis on promoting career paths. So we have a clinical ladder program that is a career development program for our nurses and essentially rewards them for their achievements and expertise. We also are, something I'm really excited about. So we're just about to roll out a new program called Empowered Education. And essentially we have some team members who, they're being paid closer to the minimum wage level. And we have really great team members and we want them to stay at AdventHealth. But a lot of times people who are only making, however many dollars an hour, they don't have the time to go to school. They don't have the financial means to go to school part-time, and they have work, they have to go take care of their family. And so a new program we're rolling out is that we're going to be paying low-income team members to go to school part-time so that they can be trained to become a surgery tech or a pharmacy tech. So basically, we're going to have some people apply to this program and we'll pay them, they'll work part-time hours, but we'll be paying them as if they're a full-time employee and give them full-time employee benefits, pay their tuition to attend school. And essentially it enables us to recognize our best team members and to be growing internal talent and growing these people who are eager to learn and eager to go to school, and we can get them into our surgery tech or pharmacy tech programs. So that's something I'm really excited about, to just invest back into our team members and to retain them. So
yeah, no, that's really awesome. I think, no, that sounds like a great program. It's definitely within healthcare. I definitely feel like healthcare workers are now looking at, when they go to work for an organization, like, how is this organization setting me up for success? Like, what are they offering me? And yeah, those programs I think are definitely coming into the equation more and more. That's really cool. Alrighty, guys. I think we have one last question for you. So we know this, the new administration is going to bring about a lot of change for healthcare and beyond, and just policies in general. So what impact has regulatory change, like minimum wage laws and overtime rules, what impact has this had on your labor cost structure, and how are you planning for potential future changes in the regulatory landscape? Brandon, do you want to start on this last one?
So for us, regulatory changes are a big component to our labor structure. Particularly in California with the minimum wage requirements, I think our budgeting process is pretty essential. We'd like to have a lot of open dialogue with our leaders, mainly around where all of our employees at. So we constantly are reviewing where we are. We've also taken a phased-in approach where we have incrementally started increasing a lot of those employees to make sure that we are meeting a lot of those standards. And in making sure that we're staying connected with our system team. I'm pretty sure you guys know, as administrations change, as you get new leaders, a lot of the things that you're planning for can change pretty rapidly. So we like to make sure that we're staying pretty close to all of those different changes, and we have a pretty overarching view of how macroeconomics are playing a role in our landscape.
Yeah, for sure. I feel like a lot of this question is just, how do you plan for uncertainty? Kaitlyn, what are your thoughts here?
Yeah, absolutely. We have a whole public affairs team who's very cued into what's going on with the new administration and everything. This question specifically mentioned minimum wage laws, so I just wanted to mention something on that. Yeah. So for us, minimum wage laws in Florida have had a pretty big impact on us. So just to give you a little bit of context, back in 2021, Florida's minimum wage for the state was about $9, not a lot. So back then, Florida voters approved to increase the state's minimum wage to $15 by 2026. So for the past 5 years, we've been on a journey the state has been on a journey to increase minimum wage $1 at a time, ultimately getting to $15 by next year. For us, so I would say we probably don't feel as much pressure from the state minimum wage laws as much as we feel pressure from other large employers in the Orlando area. So, for example, Walt Disney World is in our backyard in Orlando, and they recently bumped their minimum wage workers from $15 to $18. And so we have a lot of team members who work in, our laundry area, in our environmental services areas, and we want to make sure that we don't lose our employees to other hospitality companies in the area, like Disney and Universal Studios. And so we've been paying attention to, what are the other people in our market doing, and how do we stay competitive so that we don't lose our people to Disney or Universal. And so we're about to we're about to do a big market adjustment in March that will increase our team members higher than what Disney is paying, so that we make sure that we can retain them and keep them at AdventHealth. So that's one example of how regulatory change and competition and minimum wage laws have impacted us.
Yeah, for sure. No, that's a really good point. Yeah, forgot about Disney there.
Yes.
Cool. For sure. All right. Well, thank you both for that. That was definitely an excellent discussion. So this will now bring us to the Q&A portion of our program. So we would like to invite the audience to ask live questions to our panelists. As a reminder, if you're participating in the live version of this program right now, to submit a question, you're going to click on the little Q&A widget on the bottom of your screen. It may already be open and be on the left side of your screen. And just note that your questions will remain anonymous and will not be viewed by other audience members. So yeah, let's see if we have any questions. Not seeing any right now. Oh, sorry. I think I was muted just then. Did you guys hear me?
No, I didn't hear you.
Okay, sorry. Let me repeat that. We have one question. Do you ever partner with private capital to enhance services and modernize infrastructure? I guess either of you can answer.
So for Providence, we are a Catholic nonprofit organization. We do look at partnering with several different organizations, but for us, it would really just depend on what's the scope and how that can actually benefit both people without compromising any of our values. So.
Okay.
I agree.
Got you. Awesome. And let's see. I actually have one more question for you guys. I want to talk about data analytics, if you can talk about this for a second. What role does data analytics kind of play in helping you guys forecast labor cost trends more accurately? And how does this impact your decision-making process in terms of like staffing and scheduling and everything? Is that part of it at all? And either of you can answer.
Yeah, absolutely. So I spoke on it a little bit earlier, but we have so many dashboards for so many things, I feel like. So we have a big team of like an analytics team that works on building dashboards for all these different strategies that we're working on. So, we have a length of stay dashboard, we have a labor productivity dashboard, we have a other Power BI dashboards and whatnot, and other financial tools. Also a turnover dashboard. So it's like definitely a huge part of our of how we can make decisions and how we can be informed on, what do our trends look like? Are we going up? Are we going down? Kind of the basics. But and then with that, we want to make sure that the data is validated and makes sense. And so it's something that we routinely are reviewing with our nursing leaders, our clinical leaders, to make sure that, like, hey, like your labor productivity looks a little weird this month. Was there something that happened, or did someone get moved to your department that shouldn't be moving there, like clocked into your department? So I just back to that, making sure that we're a team with our nurses and our clinicians, and making sure that we have a curious mindset and asking questions. It all plays hand in hand together with our technology and our tools that we use.
Yeah, for sure. Awesome. Brandon, how about you? Anything you want to add? Oh, sorry, Brandon. Okay, there we go. we can't hear just like the first word of everything you say.
But yeah, similar to Kaitlyn, like we discussed earlier, we do use a lot of those data analytics tools where we are looking at everything from length of stay to, like I said, overtime, agency. I think one of the big things, much like Kaitlyn has in Providence, we're both well over 50 plus hospitals. So I think for us, it's pretty easy for us to leverage against looking at different hospitals. If we're seeing something that's off, for example, in a specific unit, maybe we're looking at NICU. And somebody else has a productivity that's 100 and something percent, and maybe somebody else is at 90 something percent. Being able to really delve into some of that data and ask, well, why is this occurring? Or looking at some of the FTE structures and being able to leverage some of our other leaders to really understand, like, what is best practice for your individual hospital. So I think that all of those things really play a key role. And for us, it's just in being able to leverage the data.
Yeah, for sure. No, good point. Alrighty. Oh, sorry. I'm seeing some other questions now. Sorry, we had them hidden for a minute. But so one of our questions is, have you formalized a virtual nursing department?
At my specific hospital, so we're looking at several of those options now. There are a few people who are out in the market and really trying to look at, does that make sense? I think that's one of the things that we're definitely looking to leverage. We do see that there's a lot of benefits to that as well. And so that's one of the things I think that we're looking to dive a little bit more into 2025.
Okay, yeah, for sure. Kaitlyn, how about you?
So when you say virtual nursing department, are we talking about like telehealth visits or?
I guess, yeah, we could say that.
Okay.
Sorry, that's all the question says, but yeah, or anything you can speak to on it, I guess.
So I mean, telehealth is a huge thing that we do. So we have our AdventHealth app. Actually used the telehealth the other day. Literally through the app, I just say, I want to talk to a nurse, or I want to talk to APP or a physician. And the call was like 1 minute, and I got what I needed. So, so yeah, that we're definitely using at least telehealth in our virtual area. So.
Okay. Yeah, for sure. No, it's definitely convenience, definitely a big part of it. And then we have one other question on here. How do you keep senior leadership accountability for labor cost-saving strategies?
All of our leaders have access to a lot of these data analytic tools. We monitor these things on a daily basis and really look for any discrepancies, any trends, and try to go from there. As it relates to, for example, agency, that's something that we review weekly at our workforce council meetings, where we're trying to understand, does it make sense to keep certain agency on? Where can we really ramp up some of our recruitment efforts? And if it makes sense to possibly look at merging certain positions. So all of those things are always on the table. I think for us, having that weekly meeting really helps us all to stay on top of it and make sure that we're all being held accountable.
Got you. Yeah, for sure. Kaitlyn, how about you?
Yeah, so similar. We have a labor productivity dashboard that not only finance, but also our department leaders can look at. It gets refreshed on a daily basis. So it's real-time information on, if I'm a nursing leader, I can look to see every single day who clocked into my department and who is working overtime hours, or is there any agency hitting my department? So that is our one-stop shop to hold ourselves accountable to the the budget that we set for ourselves. And so as far as when I was supporting specific budgets, I met with all my leaders monthly and went through not only their labor productivity but also their department financials, and we just kind of looked at that together. And that's where I was able to ask questions and want to make sure I don't make any assumptions, but just be like, hey, this looked kind of funny. What was happening here? And that's basically how we're able to uncover, anomalies or certain things that might have happened. So that's how we keep ourselves accountable.
Right, for sure. Great. And just one last little question. So, based on everything we discussed today, what are you guys saying would be one or two takeaways that we're leaving with today?
So I'll go. I think for us, the things that have made the biggest difference is, I would say, number one, recruitment and retention strategies. So when I talked about, how do we, like, our benefit packages and how do we make sure we're paying our team members fairly? I think that's a lot of the feedback we get in our employee engagement scores is people feel like, I want to be fairly compensated and I want certain benefits. And so those surveys have made a huge difference in the decisions and investments that we've made. And then the focus that we've had on promoting career paths for people and making sure that we are investing in our team members' growth and development. I think that's a huge, huge win and has helped our turnover decrease significantly over the past couple of years. And then secondly, I would say the work that we've done with reducing length of stay has made a huge, I feel like I didn't touch on that a lot today, but our length of stay reduction has found a lot of opportunities, not only for labor savings, but also on the clinical side, we've created a huge amount of capacity. So we've just in the past year or so, we've created capacity the size of a 300-bed hospital, I believe it is. And so it enabled us to find efficiencies so that we're not having to spend capital on building a new hospital. Because for Orlando specifically, we have so many people moving to Florida. And so we probably have a different, maybe we have a different problem than others where maybe more rural hospitals are struggling more to recruit and retain nurses. I think for Orlando, because we have so many people moving to Florida, we were able to find nurses a little more than we did in the pandemic. But where that creates an issue is if we have hundreds of thousands of people moving here every day, we want to make sure that we're able to provide the care for our community and that we have enough capacity to be able to support all these people who want to come here and move here and retire here. And so that's been a huge strategy for us is how can we create capacity for all these people moving to Florida? And how can we do that without spending new capital? How can we find efficiencies in length of stay, which also has savings on the labor side? So it's all kind of big strategic things that all happen together, but those would be my takeaways from our end.
Yeah, no, for sure. No, that's a good point too. Just like that influx of people coming into the state. That's a good point, particularly, with Florida and senior care, for sure.
Yep.
Brandon, is there anything else you wanted to add? Oh, sorry, Brandon. Can you start over? There we go.
With my mic, but I would probably say my stuff is pretty similar to Kaitlyn as well. We really looked at our employee engagement surveys. We do that quarterly now to really keep our finger on the pulse of what's going on. I think, like she said, all of those things are pretty important. For us, culture is another really big one. So making sure that your employees actually want to come to work every day, that they do feel heard, that they do feel valued. I think those are some of the things that'll definitely help as it relates to retention. And then, like I said, having those crucial conversations. I think the more you have those conversations with employees to understand exactly what are they looking for? Do they feel like they need more training? Can we put them in other departments to get training maybe for some of their long-term goals as well? Understanding if you are, for example, a new mom, a new dad, do you need a more flexible work schedule? Are you looking for more part-time hours? Do you need something where you are able to work from home a little bit more, making sure that you have the right role for that specific employee? And then also looking at performance, setting up certain benchmarks. for some of your employees. So if they're doing a great job, they're contributing to the hospital being a success, both from a quality standpoint, from a financial standpoint, looking at how do we look at your base salary? How do we look at incentive pay? Possibly spot bonuses. So I think all of those things really play an important factor, but it's really all about your employees. So I think the more you have your finger on the pulse of your employees and what's important to them, I think the better off that you'll be.
Yeah, no, for sure. Agreed. Well said. Thank you. Thank you both. So that is all the time we have for questions today. So in closing, please note that our next program is going to be on February 25th, and this one's going to cover the winning edge for increasing your business footprint through technology. So a live clickable link will appear at the close of this program, and this will take you to our registration page for the event. Remember to follow along all week long as we cover the topic of lowering labor costs on our website, healthleadersmedia.com. I want to thank our panelists once again today for an excellent discussion. And finally, thank you to our audience for participating. I hope you enjoyed today's program, and we look forward to seeing you at our next program, which will be increasing your business footprint through technology. Thanks, guys.